Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed a thin girl with a slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius. Pulse 100 minute. Blood pressure 110/80 mmHg. Examination of the rest of the cardiovascular and respiratory systems was normal. The abdomen was not distended. There was generalized tenderness which was marked in the right lower quadrant and was associated with the garden, but not rigidity. There was no rebound tenderness and no masses were felt. Bowel sounds were reduced. Match the description of the stools 1 to 6 with the condition most likely to cause them. A to F. Using your medical knowledge. Look at the opposite to help you. Types of stools. Condition. Number 1. Loose, bloody. Letter C. Ulcerative colitis. Number 2. Loose, pale, bulky. Letter E. Celiac disease. Number 3. Clay colored. Letter F. Obstructive jaundice. Number 4. Black tarry. Letter A. Gastric ulcer. Number 5. Small and hard. Letter B. Irritable bowel syndrome. Number 6. Clear, watery with mucus. Letter D. Cholera. Match the features 1 to 7 to the doctor's questions A to G. Look at the opposite to help you. Number 1. Blood. Letter F. Have you passed black stools? Number 2. Bowel habit. Letter A. How often do you open your bowels? Number 3. Change in bowel habit. Letter B. Are you going to the toilet more often than normal? Number 4. Bulk. Letter G. Is the size or the amount of the stools normal? Number 5. Color. Letter E. What about the appearance of the stools? Number 6. Consistency. Letter C. Are the motions hard or loose? Number 7. Offensiveness. Letter D. Do the motions have an unusual smell? Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Number 1. Hysterectomy is the surgical removal of the uterus. Number 2. Menorrhagia, menstrual bleeding that lasts more than 7 days. Number 3. Salpingitis, inflammation of the fallopian tubes. Number 4. Cervical biopsy, procedure to remove tissue from the cervix to test. Read the conversation between the gynecologist and the patient in C opposite and complete the notes about the patient. Menarche, about 12 years. Menstrual cycle, 4 to 5 days, 28. LMP, a week ago. Menorrhagia, no. Dysmenorrhea. Not really. Discharge. A little. White. Now write the questions that the doctor asked. Look at the opposite to help you. Menarche. How old were you when you started to get them? Menstrual cycle. How long do the periods last usually? LMP. When was your last period? Menorrhagia. Do you get clots? Dysmenorrhea. Do you get period pains? Discharge. Is there any discharge between the periods? What color is it? Complete the case report. One word is needed to twist. Look at B and C opposite will help you. Case 15. A 45-year-old woman had been having periods lasting for 8 days, with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flashes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a copper coil was fitted. She had had a normal pregnancy when she was 25.